In 1908, a small hospital was started near Mokwasa, Malawi as part of the Seventh-day Adventist Church's medical mission program. For more than 100 years, this hospital has provided physical and spiritual healing to one of the poorest countries in Africa. Malawi is home to more than 13 million people, many of whom live in poverty and are in dire need of medical care. HIV and AIDS are rampant and are changing the face of Malawi. People young and old are affected by a disease that shows no mercy in regards to race, religion, or social status. One of the newest additions is Dr. Chriselle Shank. She has been at Malamulo for less than 1 year, and part of her job is to train medical officer students from the hospital's medical school. As Dr. Shank works with her students, she shows patience as they struggle to find the answers to her questions. As a young doctor herself, she can relate to the training and the struggles they are facing. She went through it not too long ago herself. After finishing the students' patients' rounds and training session, Dr. Shank checks in on her own patients.
She's on high dose. Okay.
This woman is HIV positive and has given birth to twin daughters a few weeks ago. She has pneumonia and can't breathe. Her oxygen saturation level is dangerously low. Dr. Shank calls for medicine to relieve the woman's pain and to help her relax so that she can breathe easier. None can be found since supplies at the hospital are very low. Dr. Shank relies on the one treatment method that all mission doctors are never in short supply of: prayer. Dr. Shank says that HIV and AIDS patients are a large part of their patient population.
And it's incredible here because we estimate that probably 50 to 60% of our adults who are admitted either have HIV as a main cause of their problems or also have HIV that may be related to why they're here.
Despite the high number of HIV and AIDS cases, the hospital is often able to help transform their patients' lives.
Because we can take really sick people, diagnose them properly, start them on medicine, and they improve dramatically.
Your faithful support of the mission offerings each Sabbath help make it possible to train and send medical doctors like Dr. Shank, who are willing to dedicate their lives to treating the sick, poor, and helpless, just like Jesus did when he was on this earth.